Hello, everybody. Welcome back to the Incubator Podcast live at Hot Topics in Neonatology. We're in Washington, D.C., and we're joined by Dr. Pankaj Agrawal, who's the Division Chief of Neonatology at the University of Miami. Pankaj, welcome back to the podcast.
Yeah, no, thank you. Thank you so much. It's such a great platform you have created, so congratulations.
It's always a pleasure to talk to you. You're always so nice to engage with. You presented today on genomics in the NICU, something that we've talked about already on the podcast earlier today. And I think that one of the things that we were discussing is obviously that the NICU is at a launch point really for genomics and for genetic information. Tell us a little bit about you've been in this particular space for some time,
Yes.
and you've had the privilege and the chance to see it really go from something that was not that was kind of limited, I would say, mostly by the technology, the idea that we could not run these tests in a timely fashion, to a point where today it's incredible what can be done.
Yeah.
How are you seeing the advances in genomics and how that translates into help in the NICU?
Yeah, no, that's a great question. So I started doing genomics in 2000. So I was looking for a project where I had a patient with a rare disease,
Yeah.
which took us 6 months to really find the cause. And it like piqued my interest, like why it takes so much time. So I joined the lab.
Yeah.
So I had a patient with myopathy.
Yeah.
So I joined the lab, learned about myopathy in the lab. I did a lot of basic research. We were trying to do gene discovery, and it was complicated. The technology was not there yet, as you said. I'm impressed by your knowledge, by the way. So technology was not there, but we were frustrated by seeing so many patients in the NICU who do not get a diagnosis, and sometimes they just pass, and we have lost.
And you know there's something
Something
underlying.
going on.
Yeah.
Something going on. Something is not right. It has to be, as you know, genetic. People think that it has to be in the family, which is totally not true. A lot of it is de novo. It's just random
Mutations, yeah.
random mutations that occur, and you know that there is something underlying genetic, but we just don't have the technology. So it has come a long way. Now we can do rapid genome sequencing in like 2 to 3 days, and there is a whole like rat race going on to really. Now there was the latest paper like a few months back that it's 4.5 hours.
I read that paper that within the same day,
Yes.
you could get the genome. Can you believe that when we were talking about like when the genome project was in place, how much this was such an accomplishment, and now within the same day?
Same day. And that's the future. And that's where I think that neonatology is like the most fertile ground for this type of work, because first of all, we get a lot of babies who come to us who have a potential genetic condition. And then there is a lot of intervention that can be done during this age. And if you don't know the diagnosis, we are going to be stuck with how to manage them.
How do you think of babies in the NICU and genomics? Do you think that this is something that we're going to move towards universality, where you get admitted and you get genomics? Or are there specific patients that you're going to say? I know some people have talked about like growth restriction is a big red flag, and that should be investigated. What is your approach, and how do you do this at the University of Miami?
So right now we are going by a phenotype, which is like if there's a patient with subtle phenotype or something which is unexplained, we are targeting all those cases. But I don't know if that's the right approach in the current time.
Yeah.
I feel like maybe time has come to really sequence every baby who comes to the NICU, and then we may find some of these conditions that we never even thought of.
Yeah.
So that's going to happen. It's just time and effort and implementation, and like I think this will be the future. But right now, I think our bigger goal is that how can we get this technology become available in all NICUs? That's the question. So that's where we are struggling. I see that a lot of NICUs want to do it. They don't get buy-in from administrators.
Correct.
The cost supposedly is in a problem. And then if they getting consenting from the families, once you get the report, how to disclose it.
Yeah.
There are a lot of these bottlenecks which are still exist, and that's part of the problem.
And I think it's an opportunity also. I think that as we were discussing, I think we had Catherine Press-Callahan on earlier today. We have to rethink maybe how we think about outcomes and what do we do with this information, because maybe the framework that we have historically adopted is not befitting for this type of information.
Yes.
And we have to have a much more broader, holistic vision of the patient to incorporate this data into their care.
Yeah, and you brought a very good point, because I also noticed that a lot of families, when we do the sequencing and don't find there is a diagnosis, they're relieved.
Right.
That okay.
But the clinicians are not.
Clinicians are not, but at least they feel like we have done everything for their child. That we have tried to find, in some ways they are like, okay, you did the best test possible and still we don't find anything. At least I feel that you have done your best.
Right. Right.
And for us, it's also very important, right? Even if you don't find an answer, we know that we have done everything. And then we are also have a database where we can enroll all these families and we continue to work on their case by looking at new genes. Because as you know, there are 20,000 genes, but only 5,000
Right.
be linked to a disease. There are another 15,000 yet to be linked to human disease. So like actively we have right now like 6 genes that I'm working on, which are not known, but we are working on to
Make them known.
make them known. Exactly. So we are creating like cell lines, mouse models, working to really explain.
Yeah, I think that's what people sometimes forget when you submit
Yeah.
the forms for the genetic testing and they ask you some of the pathology and the presentation of the patient. That helps.
Yeah.
Because if you have a variant that is identified, this will be linked and then can help with database down the road and research and so on.
Yeah, I think there is a lot of opportunity there as well for research.
Very cool.
Yeah.
Any other sessions that you're really looking forward to at Hot Topics this year?
I think that I enjoyed the sessions today. Unfortunately, I have to leave tomorrow, but today's sessions like the 22 to 24 weeker.
Yeah, the tiny baby. Yeah.
Tiny baby was nice. And then I loved the last 2 sessions. I don't know if you heard the last 2 talks about the
more public health and
also like erosion in research.
Yeah.
And then about like why the like I think where should neonatology go in terms of research and clinical care. So that was really, I think, big picture is like 50,000 feet.
Yeah,
That's
very
really
nice.
exciting.
Pankaj, it's always good to talk to you.
Yeah, no,
Thank you for dropping by the podcast.
Yeah, it's so wonderful. So nice to see you always.